Good afternoon. Thank you for tuning in today. My name is Jeff McKay. We're going to talk about COVID-19 screening through SecureML and how that makes things easier. With us today is Christine Becky. Christine, hi. Thanks for coming.
Hello. Thank you so much for having me.
Yeah, great. And we also have Mark Air with us today, who's our Director of Customer Operations. So Christine's going to talk about her experience using SecureML in the clinic, and Mark works with all of our other clinics on SecureML. So he'll talk about the experience and then what people are seeing across the board. Hi, Mark.
Hello, Jeff. Hello, Christine. Hello, everyone.
So Christine is from Riley Park Maternity, and Christine informed me before we got started that it's actually 5, or did you say 6 clinics, Christine?
5 clinics. Yeah.
All right. Okay. So you've got a lot of staff under in the organization. You got a lot of clinicians in the organization. You're collectively seeing 800 patients a week, and through that sending somewhere between 2,000 and 2,500 messages a month. Can you talk a little bit about how you've reached that point, and how SecureML fits into the clinic generally before we dive into the COVID-19 stuff?
Sure. We, the COVID-19 and the SecureML kind of hit us around the same time, so it wasn't a great solution to kind of get us started. But back in, so let me back up. I am the program manager at Riley Park Maternity, and we are support family doctors, about 42 different family physicians who all take turns in the clinic on a weekly basis, taking care of prenatal patients and seeing them in the immediate postpartum period. We also have a lactation consultant clinic, and 4 or 5 MOAs that work with us on a daily basis, and other support staff. So because of that, we have a lot of people coming through our clinic on a weekly basis.
Yeah. Let's talk about the COVID-19 stuff, because it wasn't something you started doing right away. I think, like you said, these things hit at the same time. So we're working with your primary care network to roll out SecureML across the network to all of the primary care clinics and any of the supporting clinics as well. So there's an ecosystem coming here, like building out. And so, I think, can you talk about how you started with COVID-19 screening, like how that developed and how you got into using SecureML and how that works now?
Yes, absolutely. So back in March 2020, when COVID hit us, we knew it was really ideal to avoid infected or symptomatic patients coming to the clinic. And in reality, as a maternity clinic, we still needed to see patients in person. We couldn't just postpone every single appointment if they had a symptom. So we were phoning every patient the day prior to coming in and doing a COVID screening, just to ensure that we put that all of our processes in place could happen to prevent transmission to other patients, physicians, and staff. So we started that in March, and basically, each MOA was calling 30 to 34 patients every day. We have 6 MOAs, that's over 200 calls a day. And it was taking 2 or 3 minutes a call. So we were looking at 8 to 10 hours a day of total time that this was taking for our staff, which was unsustainable. And so we were desperate to find something else. So when Brightsquid was kind of started, and we figured that we could screen this way, it just made a huge difference to the flow in our clinic. So for example, just to give you some numbers, it now takes each MOA about under 5 minutes to send a screening email to every patient each day. So, now we've got it down to basically an hour and a half of total time for my clinic that the MOAs are taking versus 8 to 10 hours.
And sorry, is that daily or weekly?
Daily.
Yeah, so it was from 8 to 10 hours down to an hour and a half is what you've done. And just along those lines, so
that's total. That's total across 6 different MOAs, right? But still, when I look at the total use of my staff's time, that's a huge impact.
Yeah, I mean, we're talking a 75 to 85% decrease in time spent on a task. And so, just, I mean, quickly, that's a really, really impactful number. Like, what does that empower staff to do? Like, what else? What are they doing now instead of making those calls?
Well, to put things in perspective, this was an extra task that we never had to do before COVID hit. We were not pre-screening everybody the day before. So they already had a full work day with their regular work job. And then all of a sudden COVID hit and we had to somehow build this into their time. And it was, yeah, I mean, it was becoming crazy and unmanageable. So there was high motivation to learn this and to use Brightsquid. And we had a few challenges, on how do we communicate which patient has signed up for Brightsquid or not. And, that took a little bit of time to kind of figure out a workflow that was going to work in our busy clinic. So we had good communication between our receptionist, our MOA, and the physician who was working in the pod, and with our nurses too, so that everybody had a heads up before somebody even came in, or whether they were screened or not.
Yeah, and Joe and Mark, I mean, you work with hundreds of clinics, and in terms of setting up templates. So, Christine, you pointed out earlier when we were talking that there is a global template, a template that everybody can use that has a COVID-19 screening questionnaire in it. It's editable. Christine, you're not using that template. And Mark, there's other clinics that are. Can you talk about some of the impacts that you've seen in clinics that are using it, and some of the other ways people are implementing these templates?
Well, I mean, as you say, Jeff, when the template feature was introduced to our secure mail users, I don't know, about a month or so, maybe 2 months ago now, we included the global templates really as a way to get people thinking about how they wanted to use the templates for their own custom information. And so we've seen, a tremendous growth both on the communication out to patients in the way that Christine is describing, but also in messages that are going to professional users. So a lot of our clinics, in addition to talking to their patients through Brightsquid Secure Mail, are also sending referral information, follow-up on referrals. That's actually one of the, I would say, probably in the top 5 number of most used templates is for specialist clinics that are sending the referral letters back to the original referring doctor. I saw your patient, this is what we did, here's the results, and then they can attach all of the relevant documentation. And those sorts of things, to Christine's point, are just, giving the staff time back that they used to have to do a lot of manual effort. Now we've automated a lot of those processes and let them use that time in more productive ways.
Yeah, and that is a really great point, right? We've all been forced to figure out how to adapt, right? It's another workload, and I think you'd be hard pressed to find a clinic or anybody working in the clinic a year ago who said, yeah, I really need to find ways to fill a couple more hours every day with more tasks to work on. And now we've got screening, we've got extra cleaning protocols that have to be done, and so things take longer. And so finding these ways to be this efficient. How long of a process, Christine, was it to figure out how to execute these? And can you talk a little bit about your process? Because I know you're not requiring a response from patients. How does that work?
Yeah, so because we were doing this before the templates were available through Brightsquid, we had developed our own letter. And at that time, we were copy and pasting from our desktop into Brightsquid to send the message out to everybody. Because of our numbers and the workflow, the existing workflow, it was really difficult for our MOAs to check back by the end of the day to see if every single person had responded, because a lot of people were working and they weren't even responding to the email until it was at night, which meant then that the MOA had to double check the email inbox in the morning. And if somebody had screened positive, or if there was a question about it, you had to call them and cancel. Like it didn't work for a workflow very well. So that's why we opted to use a general information email. And then at a patient's first visit, we make sure that they actually sign a contract with us to say, yes, I understand the importance of COVID screening. I will read the email prior to every visit and know that, you know, we basically stress the importance of doing that for the safety of everybody in the clinic. Because we do that, we can just send this email out now, knowing that that person has read it, knows that they're responsible to do that screening. And if there's any, you know, symptom at all, they're to call us the day before or call us before their appointment, and then we make arrangements and decide whether they need to be seen in clinic in a safe way or whether we can postpone that clinic for a later time, or that visit for a later time.
Right.
Does that make sense?
Now, yeah, no, of course, yeah, and it was a really interesting approach, and I think because as we're looking to limit people's extra work, you know, the idea that, you know, there is some effort involved in scanning the emails, understanding who said what, and that kind of thing. So you know, it's absolutely, I think, appropriate in a lot of ways to involve patients in the care in that way, especially if we have a you know, that kind of contract in place. Now, Mark, we've got the read receipts function, and I mean, you can talk a little about that. Christine, do you use that? Does read receipts form serve for you as a closed loop tool there?
Yes, some of our MOAs will do it, but again, it means cross-referencing to our electronic medical record, which is a little bit, it takes time, and so that's a little bit of a challenge, and which is why we didn't stress the fact that people had to respond, because as soon as you ask everybody to respond, we now have to actually double check and look at all of those emails that come back in, where when we don't ask them to respond and we know that they're responsible to read that before, they still get screened when they come into the door, but this is just the first screening process. Then if they do respond, there's less of them, it's much easier to manage, and there's a reason why they're answering. So some people will respond to it and say, yeah, actually, you know, I've had a headache for the last 3 days, but I'm pregnant, so it's probably normal. And we want them to tell us that, because then we have a chance for the nurse or the doctor to give them a call back, to delve a little deeper and make sure that if we're concerned at all that they're not sitting in the waiting room with other patients, we bring them directly back into an isolation room, and we're just preventing any chance of having to do contact tracing or having our staff, you know, exposed.
Yeah, that's great. And Mark, what have you heard from other clinics that are working in this way?
You mean with regards to the read receipts or other activities?
Oh yeah, I mean both. Yeah, really. I mean, like managing this process and yeah, I mean, read receipts is part of the original question there, so we'll talk about it.
Yeah, you know, the important thing to remember, or one of the important things, goodness, I could go on forever with a lot of different important things to remember, but you know, the one thing here that I think is sometimes missed is that, you know, the value of Brightsquid Secure Mail is that it's just a more efficient way to send information, to communicate information. You know, Christine talked earlier about the issues with leaving phone tag messages and all the back and forth that it requires. Just to have a successful phone call with a patient can take literally, you know, days. Whereas with Secure Mail, it's, you know, I hate to sound glib, but it's fire and forget. You send the message and the patient will get it. If there's ever any issues, the patients will contact our support team, and they're happy to help. And when and where the closed loop is required, the read receipts are available to the sender whenever they need them. So it's a different way of accomplishing tasks with more efficiency.
Yeah, and I can comment on that and how important that is in a busy workflow day, because you know, our MOAs are pulled for many different jobs all day long. And to be playing phone tag with patients is just another disruption in their regular workflow. And I mean, when you're looking at the volume of people and numbers that we deal with, it's really disruptive to their day. So this has been a huge help. And just talking about templates, we use our templates so much more now because we send a lot of teaching material out ahead of time, which again is another great feature. And you can build your own templates. You have to use the ones that are there.
Yeah, so I want to talk about that. We're at our time, so just want to kind of get through quickly. We have a couple questions. Hopefully, people can stick around for a couple of minutes. Is that okay with you, Christine? If we just do a couple extra
Yes,
minutes?
that's fine.
Awesome, great. So yeah, we do have some templates that are there already. You know, the COVID questionnaire is there. You can edit templates. There are some tutorial videos about how to use templates. You can, as Mark said, always talk to the support team. There's a few sort of popular ones we put in here. The questionnaire obviously is a big one. You invite for patients explaining how SecureMail will be used, almost kind of like what Christine was talking about with, you know, not necessarily a contract in this sense, but this is what we're going to use SecureMail for. Here's what, you know, you can expect to use SecureMail for as well with us. You know, here's how to send a photo. And that template is taken from a couple clinics that started doing that, because patients can send photos to help with phone consults or, you know, in-person visits beforehand, so that there's an idea of what's going on going into the appointment. And it helps if they do that in a certain way. You know, it talks about lighting, that kind of stuff. And these are templates that you can edit. So by you selecting them, you can click on edit and make some changes there. This is what a template looks like. You can see here, you can have the recipient name auto-populate. So you can address a message, send a message to multiple patients in the two fields, like what Christine her team is doing, and their first name will go in there. And patients don't see other patients on a SecureMail message. So if you have 150 patients on a message, to the patient, all of those patients, it feels like the message was sent right to them. They don't see a list of other recipients to protect everybody's information, obviously. So you can select that here. You can put in, here's where I want to put the recipient name. Here's where I want to put the sender name in here too. And that'll show up there. We do have a couple of questions that I want to get to very quickly. The first one is, and there is a question panel in your GoToMeeting control panel on the right side of your screen. First question is this integrated into the EMR? So SecureMail in this way is not integrated into the EMR. We're building out certain integrations with TELUS EMRs, TELUS Health EMRs. You can use SecureMail from TELUS Health if you have the MedDialog add-on, so you can send something directly from a patient record. That would not work with sending multiple messages. You can send one message from the EMR at a time. So this is just a matter of logging in. Once you have patients set up, and Mark, you can talk to this process. Once you have SecureMail set up, if you want to get more patients on board, then we can help you invite your patients en masse. Mark, do you want to talk about that process quickly?
Yeah, sure thing. The typical way that patients get invited to SecureMail is that they're invited on demand, as I like to say. So if you have a message to send to a particular patient, much like with a regular email, you compose the message, you send it off. And if it's that recipient's first time using our service, they'll be invited and they'll establish their account based on that one-off invitation, if you like. We can also do that for you in more of an automated procedure, where if you provide our support team with a list of the patients you'd like to invite and the content for the invitation message, you know, dear patient, here's how we use Brightsquid SecureMail, we can send that out to 100, 200, 1,000 patients at a time to save you that onesie twosie invitation process, if that would be helpful.
Great. And then one other question here, because we don't have a lot of time. What about, so other use cases, and people are asking about using with professionals, and Mark, you kind of talked about that a little bit, and Christine, I know you said you're looking to transition off fax onto SecureMail with your notes back to family doctors. Can you talk about, you know, what you see the potential for that there?
Well, yeah, it's, I mean, ideally, once we can build it, once we build another template for a discharge information of our mom and babe information that goes back to our family doctor. Right now in PS, we have a letter and then we fax it from PS to the family doctor, but you know, fax lines aren't really that secure. I think that whole process is leaving, and Brightsquid, or at least a secure email platform, I think would be a much more efficient way. So once we have that all built and we know which family doctors are signed up into Brightsquid, I want to add that into our process so that we basically are just can communicate directly during someone's prenatal care and after, to give out all the information that we need back to the family doctor just straightly through this, and get rid of facts completely is the goal.
Yeah, facts the facts, as I say. That's great. Well, that takes us to our time. And Christine, thank you so much for tuning in today and joining us and sharing your experience and your knowledge and expertise in this way. It's been very interesting, and hopefully, you've got a lot of people on the line here today, so hopefully it's useful. This session has been recorded. We will be posting it and sending it out to everybody who's registered, but it will be available on the Brightsquid website as well. So, Christine, thanks so much. Mark, thanks for your time and insight as well. And have a great weekend, everybody. We'll see you next time.
Thank
Thanks,
you.
everybody.
Bye-bye.